patient ready? Okay. Hi, I'm Dr. Lizi. Very nice to meet you. I know they transfer you from an emergency. Okay. Can you please focus on my nose? Okay. Can you close your right eye? Close your left eye. Okay. What can you tell me about your vision? Can you see good? Okay. I show you 2 fingers. You see 2. Okay. You see 4. Okay. Do you see 3 fingers right now? You see 2. Okay. Do you see 2? Okay. Do you see 1 finger? Okay. You see finger that moves? I want you to look right there. Okay. You see fingers that moving? I want you to look there. Okay. I would like to examine your eyes a little bit closer. Try not to look at the light. Try to focus on the picture on the walls. It's the same level with my nose. Okay. Yeah, you're doing great. Keep looking there. Okay, now I'll try to, I want you to try to focus somewhere closer, not as far as that wall right there. Try to focus somewhere here. Check, catch the dot right here. Where's my finger? And try to look there. I'll remove my finger now. Keep your focus right there for me. Okay. Let's find a focus right here. Maybe a little bit closer right here. Yeah. And look right there for me. Okay, keep your focus there. Just a moment. I'll open your eyes just a bit bigger. I'm sorry about that. Keep looking there. Perfect. Now come a little bit more closer. Okay. Okay. I want you to blink a few times. It's too much light, I know. I'm going to change my otoscope to a different one. Okay, now I'll ask you to look right here. Okay, can you look right here? On the top of... I don't know how to call it. Yeah. Okay, I'm always looking there. Perfect. Good. Yep, right here. Perfect. Okay. So tell me about your peripheral vision more. If I move my finger from left to right, at some point, did my finger disappear from your vision? Or there at some point there's a blur circle or blur point? Okay. From the top to bottom, is there? Okay, let's try from the corners. Try not to move your head. Keep your head straight. Let's see, from that corner to this corner, would you be able to see any blind spots? Okay, and from that corner to this corner. Okay, now I will close your right eye with my hand. Now slowly move my finger. Look at my finger. Whenever you see my finger do this move, I want you to let me know, okay? You ready? Okay. It didn't right. Okay, we'll switch. You remember whenever I do this move. Okay. Okay, perfect. Switch. Okay, switch. Come from this side. Okay. Okay, I want you to look right into my eyes now. Look right into my eye. Whenever you see my finger appear, let me know. Okay. Look right into my eye. I'll close your right one. Whenever you see my finger appear, let me know. Okay. Okay, do you see this point right here? Yep, I want you to look at that little thing right there. Okay, yep, keep looking here for me. Open your eyes a little bit more wider, okay? A little bit more wider. Yep, perfect. Keep looking right here. Okay. Looking right here. Okay, so our patient had a trauma or something. If you don't want to answer, that's okay. You don't have to. Okay, I just want to make sure that you'll be able to see the letters right here. Okay, there's a board right here, and there's one more board on this side right here. Okay, so I will disappear from your vision now, and I'll ask you to tell me the third line on the green background. If you can read it. Third, yeah. Okay. Okay, now let's turn to this board right behind me. Okay, can you be able to read fifth line? Fifth line, yeah. Okay. Can you be able to read fourth line right here? Okay. Okay, now let's move to the board right there. Can you be able to read for me second line on the green background? Okay. It's just a question, but maybe you'll be able to read the last line on the green background. Okay, that's fine. Okay, let's move to this board right here. Can you be able to see the seventh line? Okay, it's okay, that's fine. That's fine. Okay. I'm gonna put green lens right in the front of your eye. Okay. Your other eye. Okay, we'll change the lens. I'll ask you to open your mouth for me. See. Perfect, there's no inflammation. Okay. Again, close your mouth. I'll give a little bit pressure right here. And I want you to say with your closed mouth. Make that sound. It's not a saying, actually. Yeah. Okay. Okay, great. Now with my fingers, I would like to examine your facial muscles. Okay, so I'm gonna give pressure on the bottom of your eyes and the top of your eyes, okay? And I'll ask you to blink for me a few times. Okay, does it feel comfortable? Okay, now I'm gonna give that pressure this side, and I'll ask you to blink for me a few times. Yeah, does it feel comfortable? Okay. I'm gonna put 2 fingers on this eyebrow. I'll do that. Okay, just relax your face. That's great. I'm gonna put 2 fingers right here. Relax your face. That's great. Okay. Okay. Don't worry, it's a very soft hammer. Okay. Okay, now I want you to give me your wrist. I want to make sure that you know that one stick is sharp, but it won't give you any pain, and one not sharp at all. It's half soft, solid silicone tape that won't hurt you. Okay, so we're just going to do that, and I want you to let me know if you can feel the difference between the sticks. Okay, now I want you to tell me which side is softer than the other one. Okay, let me give a little bit more pressure so you'll be able to understand it. Okay. Something changed? Be good to do that around your ears as well. Okay, it feels fine, comfortable. Okay. This here. Okay. Okay, I'd like to examine a little bit of your jaw and your neck with the sticks, okay? If it feels uncomfortable, I want you to please let me know. Okay. Give you a few instructions while I'm looking into your pupil. Okay. I want you to look a little bit up for me. Yep. Try not to blink now. Okay, try not to blink. Look a little bit more up. Okay. Yep. Okay. Hold your vision there. Perfect. Okay, now can you draw a circle for me? Just imagine you're drawing a big circle for me. Yep. Don't rush, that's fine. to blink, you can blink. If you feel like you want to close your eyes, you can close your eyes. Okay? Just your reflexes, that's all. Okay, I want you to look at my nose right now. My nose. Okay, keep looking at my nose. Right here. Okay, look at my nose. Right here. Okay, that's great. What can you tell me about your colorblind vision? Okay, so would you be able to see number right here? Okay, I'm going to turn it. Would you be able to see number here? Okay, tell me number here. Okay. Now be careful. I'm gonna make one step back. Okay, tell me if you can see number right here. Okay. Okay, now be right here. Tell me if you can see the number here. Okay, I'm gonna make one step forward. I'm gonna switch it. Tell me if you can see the number here. Okay. And one more. Can you see number here? Okay, sorry, I lied. When I said one more, I meant there's one more, but it's really hard to understand. I guess it's like that. Can you be able to see? And that's okay if you can't. Okay. That's fine. Will you be able to see my nose again? Yeah, look right here. And with your left peripheral vision, do you see the color I show you? Okay, can you possibly explain me what do I show you? Okay. And right here. Thank you. With your right peripheral vision now, try to tell me if you can see what I show you. Okay, color. Okay, great. And now, gonna look right here. Now, can you be able to see? Yeah. Okay. That's good. That's very good. Okay, so what can you tell me about your hearing? Do you think you have any problem with your hearing? Okay. I will just have a look with this tool. Okay, that's fine. I don't see any problem with your ears. Only maybe I can suggest you to clean it. If you want, I can advise you any doctor if you like, and I can get you an appointment. Also, if you ask me to, just so you know, but that's not an emergency, and there's no problem. It's just a procedure that everyone should do time to time. Not often though. Yes, very often. Okay, I would like to check your hearing. Tell me if you'll be able to hear any noises right now. Okay, the same tweezers. Don't look down, okay? You will hear from one side only, and I want you to tell me from what side you hear the tweezer, okay? Right, left, in front of you, behind you, on the top of you, under you. However it feels like, okay? Moving or it doesn't move. Whatever you can catch, okay? Good, okay. What about now? Okay, and now? Okay, what about now? Okay, great. I have a tube, and from that, through that tube, I'll whisper something into your ear, like a number. I want you to repeat this number, okay? Repeat this number, please. Number 84, 84, 84. Okay. Number 55, 55, 55. Okay. Number 28, 28, 28. Number 30, 30, 30. Okay. What about this? Okay. How about okay. 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 Not bad. Okay. Now I would like to examine your sense of smell. Do you think you have any problem with that? Taste or smell? Okay. Okay. Well, would you be able to smell this for me? Okay. What about this? Okay, if you need more time, that's okay. Just let me know. No problem. Okay, this one I want you to try. Okay. You can eat, don't worry. You can eat this one. Okay. What about this one? This one I want you to smell. Okay, now try this one for me. Yeah. Okay, and one more. I want you to smell this one for me. Oops. Okay. Okay, imagine that you have to freeze your vision no matter what. Okay, just freeze your vision for me. little piece of cotton. Okay? Now try to bring it as close as I can to the area around your eye, maybe close to your eye. Okay, just want to make sure. I want to see how you react. Don't worry. Do you felt it? Okay. You felt it here. Do you feel it? Okay, what about now? And now? What about now? No. 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 Okay, let's make it more sharper. Okay. Makes you blink, that's fine, that's okay, it's normal, this is how it's supposed to be. Okay. I want you to tell me the color you see right here. Tell me the color you see right here. Okay. I want you to look right at my nose. Whenever you see black pen disappear from your vision, let me know. Or whenever you see red pen disappear, but I will let you know when black or red's supposed to disappear. Okay? Look right at my nose and now tell me when black disappears your vision. Okay. Does red still in your vision? Okay. Let's do it again. Tell me whenever you see red disappear from your vision. Okay. Do you think black pen is moving right now? Yeah. Okay. Tell me whenever black pen disappears in your vision. Okay. Whenever red pen disappears in your vision. Okay. Tell me whenever red disappears from your vision. Whenever it disappears. Okay, tell me whenever black disappears. Okay, tell me whenever black appears. Okay, whenever red appears. Okay, that's great. Now we'll go behind you. Okay, and we'll do something. Don't worry. So now I'll try to turn your head to the right. Don't let me do that. Okay, try to hold your head. Don't let me turn it to the right side. Okay. Good, very nice. Okay, now I'll try to turn your head to the left side. Don't let me do that. Hold your head straight. Don't let me turn it to the left side. Okay, great. Okay, now try to nail it down. Don't let me do that. Try to hold it. Okay, yeah. Now I'll try to lift it up. Lift it up. Up. Don't let me do that. Okay, great. Your shoulders. Okay. I'm gonna check your nerves with my hammer. Good. I want you to relax your shoulders. Relax. Okay. Nice. I'm gonna leave my hammer away, and I'm gonna press. Give a little pressure to your shoulder. Okay. Pressure down. You hold your shoulders straight. Okay. Let's do it again. Okay. Great. Now I want you to look at my face, and with your right hand, with your pointy finger, I want you to look at my nose, and I want you to touch my nose with your pointy finger. Okay. Now I'm going to close your eyes. I closed your eyes. You remember where my nose is? With the same finger, I want you to touch my nose. Almost there. Okay, I'm going to open your eyes. With your left hand, I want you to do the same thing. Remember, where's my nose? Touch my nose with your pointy finger. Now I'm going to close your eyes. And I want you to do the same thing. Touch my nose. Okay, that's great. Oh, you got it. Okay, now I'm going to close half of your peripheral vision. Okay, something like that. And I want you to touch my nose with any finger you like. Okay, now switch fingers. Okay, now I'm going to put my hand right here. I want you to push push it to the right side, towards right side. Towards right side. Okay. Push it towards left side. Okay. Open your arm for me. I'm gonna give a little pressure with my body. It's gonna be a lot. I'm giving a pressure for 2. Yeah. Okay. Just like that. Great. Try to hold as much as you can. Try to hold. Let's see how strong you are. Very strong. Good. Okay, very strong. I'm not sure why they bring you through the emergency to my office. Was it a trick? Or because it's fine. It's fine. Only thing I said is maybe you need to see an eye doctor one more time a little bit later if you're not comfortable with your vision. Okay. Maybe you can clean your ears, but your ears is fine. I don't see any inflammation or redness or something suspicious that will make me do something. Okay. So we are almost done. I will let you go. Okay. I'm going to disappear. I wish I could, but no. I will just walk around you. Disappear from your vision. Tell me if you hear anything. Okay. What about now? Okay. Do you think this sounds the same? Sounds. Okay, what about now? Only on your left. What about now? Only on your left. Right. I'm sorry, yeah. Do you hear sounds moving? Can you tell me direction? Maybe you can catch it? Okay. Can you catch it now? Okay. What about now? What about now? And now. Okay, perfect. Well, I really think everything's fine. Yeah, you're good to go. Please take care. Okay. If you feel like you need glasses, you can get your glasses, but I can say you really need them. If you work a lot on a computer, if your eyes get tired, if you feel like your eye needs more time than usually to focus, maybe you can go check an eye doctor. Maybe they'll prescribe you eye drops, which is possible. Sometimes we do forget to blink, and your eye drying, so eye dries. For this reason, you might need, but still, yeah. Okay. You're very welcome. Have a wonderful day, please. Okay? Please take care of yourself. You're very welcome. Bye-bye. Okay, you rushed me here for nowhere. Everything was fine.